Welcome back. Today we'll be discussing drugs used in obesity. As an overview, the term obesity is given to individuals with a body mass index greater than 31 kilogram per meter squared. Now, obesity is a complex disorder involving an excessive amount of fat in the body. An individual whose body mass index is greater than 30 or greater than 27 with at least two comorbidities, for example, hypertension and diabetes, is considered a potential candidate for pharmacological treatment of obesity. Now, obesity can coexist with some morbidities, and these morbidities include hypertension, diabetes, heart disease, strokes, and some cancers. So when we see at least two of these comorbidities with a body mass index greater than 27 kg per meter squared, then we can consider the patient as a potential candidate for pharmacological treatment of obesity. Now, as a revision, we have two types of obesity. We have the exogenous obesity and the endogenous obesity. The exogenous obesity is a condition in which a person is overweight as a result of an excessive intake of food and physical inactivities, while endogenous obesity is caused by an endocrine disruption. That's when the endocrine system that regulates our body is disrupted. It can lead to obesity as a complication. Now, causes of obesity includes consumption of too many calories, e.g., fatty and sugary food, living a sedentary life or lack of exercise, medications. Some medications lead to weight gain, e.g., glucocorticoids used in treatment of rheumatic arthritis and some antidepressants, obesity genes, pregnancy, use of oral contraceptives for a very long time, and genetic factors. So we have management, the way we manage obesity, and they include avoiding fatty and sugary food, eating more fruits and vegetables, exercise, having enough sleep, surgery, medication. Now, we'll be focusing on the medication aspects of the management of obesity, and I'll be teaching you how to remember these drugs. Now, the drug used include anorexants, lipase inhibitor, serotonin agonist, and combination of some drugs. The anorexants include phentermine and diethyltryptamine. Phentermine and diethyltryptamine. Now, the mnemonic used to remember anorexant include anorexant increase fight among children and this give their mother hypertension and increased blood pressure. So we'll be using this mnemonic, and I'll be explaining this mnemonic by the end of my explanation of anorexant. Now, the mechanism of action for anorexant, which is the MOA, is it increases the release of norepinephrine and dopamine from nerve terminals, and by inhibiting reuptake of these neurotransmitters, thereby increasing the level of neurotransmitters in the brain. The increase in norepinephrine signals a fight or flight response by the body, which in turn decreases appetite. So it is a flight or fight response signal as a result of increase in norepinephrine that decreases appetite, which is the mechanism of action of anorexia. And the pharmacokinetics, diethylpropyl is rapidly absorbed and undergoes extensive first pass metabolism. And the route of excretion is through the kidney. Now, adverse effects of the use of anorexia include constipation, headache, insomnia, dry mouth, and dependence. Now, contraindications include we should avoid it in patients with cardiovascular diseases or cardiovascular disorders such as hypertension, arrhythmia, etc. Now let me explain the mnemonics to you. Anorexians increase fights among children and give their mother hypertension and increase blood pressure. Now, fight is the making of action. Remember, anorexians act by stimulating fight or flight response by increasing the amount of norepinephrine in the brain. So, if the amount of norepinephrine is increases in the brain, flight or fight response is stimulated, and the body responds to this flight or fight response by decreasing appetite. Now, among children, the child in the children can be used to remember the side effects, which include constipation, headache, insomnia, dry mouth, and dependence, and gives their mother hypertension and increased blood pressure. It can also cause hypertension and increased blood pressure. So it is advised to be used in patients. It is advised not to be used in patients that have hypertension and increased blood pressure. So it is contraindicated in individuals with cardiovascular disorders or cardiovascular diseases. For lipase inhibitors, the only drugs in this category is Olistat, and a mnemonic that will help us remember some of the high-yield concepts in lipase inhibitors are only fools beat pregnant women and prevent them from taking vitamins and other classes of food. Now, only start. You can use that as an example. That the only, let me find a good pen. Only here can help us remember our only stats. So only fools only stats. Now, before I go back to the mnemonics, I would like to explain the actions of Olistat. So, Olistat is a pentanoic acid esters that inhibits gastric and pancreatic lipase, thus decreasing the breakdown of dietary fats into smaller molecules that can be absorbed. So when Olistat inhibits the lipase, dietary fat is not broken down and is not absorbed. Now, Olistat is administered orally with each meal that contains fat, and it is mainly excreted through feces. Now, the adverse drug effects, it includes GIT symptoms, which include flatulence with discharge, oily spotting, fecal urgency, and increased defecation. We can also have liver injury and pancreatitis. Now, there's interaction. It can interfere with fat-soluble vitamin absorption. So when one is taking Olistat, the person should be on multivitamins because it can interfere with the absorption of fat-soluble vitamins. It can also interfere with the absorption of some drugs, which includes cyclosporine, levothyroxine, and amlodipine. A way of explaining the mnemonics. Only represent only stats, only foods. The foods represent the side effect. Remember, it can cause flatulence, it can cause oily, spleen, can cause urgency, that's fecal urgency, which increases what? It increases defecation, frequency of defecation. It can cause liver injuries, and it can also cause pancreatitis. Remember, it inhibits pancreatic lipase, so it has the ability to cause pancreatitis. With pregnant woman, it is contraindicated in pregnant woman. It can affect the fetus in pregnancy, so it is contraindicated in pregnancy women, and it prevents the absorption of vitamins, especially fat soluble vitamins, when taken together, and some classes of food. So the classes there, C there represent cyclosporine, L there represents levothyroxine, and A there represents amodandron. Serotonin agonist can also leucoserine. So leucoserine is a serotonin agonist that we can use in the treatment of obesity. It binds specifically to serotonin 2C receptor. So it binds to serotonin 2C receptor, which it activates pro opiomelanocortin, and this pro opiomelanocortin in turn activates melanocortin receptors, which cause decrease in appetite. So this is the um, mechanism of action of serotonin agonist leucoserine that helps in treatment of obesity. Now, we should know that the pharmacokinetic is that it is metabolized in the liver and it is secreted in urine. And also, we should also know that the receptor is only found in the central in the CNS, that's the central nervous system. So it goes into the central nervous system, activates these receptors. These receptors activate pro-opiomelanocortin, which in turn activates melanocortin, and melanocortin helps in the decrease in appetite. Some of the adverse effects of this drug include nausea, headache, dry mouth, dizziness, and constipation, etc. So the combination therapy, we can use we can use two drugs. The combination therapy makes use of phentermine and topiramide. So I corrected the drug topiramide. So topiramide is an anticonvulsant. It has a sedating effect, and the reason why we're using phentermine is to oppose the sedating effect of topiramide. So phentermine is a stimulant. It stimulates the brain. Remember, its mechanism of action. It increases neurotransmitters in the brain. While topiramide, as an anticonvulsant, is a sedating agent. It can cause sedation. So phentermine and topiramide is used because phentermine can oppose or counteract the sedating effect of topiramide, and phentermine can also add to what the therapeutic effect, which is to treat obesity. It can increase the action, or it can it can promote weight loss. Now, this combination is not used in pregnancy. It's contraindicated in pregnancy because it can cause cleft palate, and topiramide is a weak carbonic anhydride inhibitor, so it is not used with carbonic anhydride inhibitor because it can cause kidney stone. Topiramide also decreases the efficacy of of oral contraceptive, so we should not use this drug when we're using oral contraceptive. Now, some of the side effects include suicidal ideation, cognitive dysfunction, and parathesia. So we have discussed anti-obesity, that's drug used in obesity, and we started by saying that obesity is it's a metabolic disorder, a complex metabolic disorder that involve accumulation of fat in the body, and we talked about the drugs. And I told you, I gave you two mnemonics that will help you remember the drugs used in obesity. The first one is the anorexiant, which is anorexiant increase fight among children and give their mother hypertension. The fight gives their mother hypertension and increased blood pressure. So anorexiant acts by increasing the fight or flight response, which decreases appetite. And the second one is the one using lipase inhibitors only fools pregnant women and prevent them from taking vitamins and other classes of food. And the only there is Olisat. Olisat is drug used in this class. Thank you. If you have other mnemonics that have helped you in understanding drugs used in obesity, you can drop it on the comment section. If you love this video, give it a thumbs up. Thank you very much. God bless you.